guys, for letting us come to your coffee hour again. Please help yourselves to any coffee or rolls or raise your hand and I'd be happy to bring you guys one. But May for us in the healthcare world is Mental Health Awareness Month. And so we have two of our amazing professionals here today. We have Stephanie Rootlinger and Jamie Roberts. And it's going to be, like it always is, just a good low-key conversation. We're going to talk to you about some stuff, but please dive in with any questions along the way.
Okay.
That sound okay? All right.
I'm going to start because I really dislike talking to groups. So I'm going to go first and tell you about myself. So a lot of you know me. My name's Steph Rootlinger. I have been a nurse 25 years, provider 15, and mental health provider for, oh gosh, what's it been, 3 years now? So I really just kind of followed that track. I do still a lot of family practice, but as I was doing family practice, I realized, oh my gosh, almost everybody or every third person I saw had something mental health related that they wanted to talk about or they weren't sure about, or what do I do with this? So I kind of saw the need to broaden. And you guys know we live in a rural community. Anything that we can do to help our scope is important. So I thought, you know what, I'm going to get some extra schooling and see if I can help my community even more. And it turns out I really did. So it's been kind of a booming practice. And you guys all know Ann Young, she's with me too. And we just kind of have a really great mental health program at Lexington Regional. We're very lucky in that sense. Like, we have people that travel from all over, Broken Bow. I have people that come from North Platte, McCook. So we cover a wide range of things. So I kind of have a few things jotted down. Sorry, I have to use my notes. So mental health team services, we cover trauma response, grief. Like if you're having some grief issues, having trouble processing, we can help you with that. Life changes, like say you have a family member that has to move into assisted living, or you have a kid going to college. Like there's some things, sometimes that's really hard transition for families. So we can help you with that. Mood, anxiety, anger, focus is a huge topic right now. Am I focusing right? I don't feel like I'm getting things done. Females, as they get a little bit older, tend to have some hormonal changes, and that affects our focus. So we're here for that. My role is typically, I do the medicine, so I'm a little bit of a medication slinger. So you come to me, we talk about your issues, and then I decide, hey, I think this medication would help you, but I really love my counselors. Like most of the time I'll say, hey, I can help you with this, but you've got to see my friend Jamie or Tracy or Karina. We have 3 counselors. They're all excellent. But a lot of times medication and the counseling is the evidence-based way to kind of manage these mental health concerns. And just because you're on medication for a while does not mean you have to be on it forever. It may be a short-term thing. It may be something that you're like, hey, don't take that away from me. I really need that. So lots of different avenues to go down. Let's see. So yeah, I'm going to kick it over to Jamie, and she's going to talk more about what services they provide, because Jamie has a whole nother realm of things that she does beside Ann and I. So I'm going to let her talk now.
So nice to see everybody. Glad you're here. So my sort of journey is a little bit unconventional, I guess. So I received my undergrad in music business, of all things, many years ago, and always felt like a little bit like unsettled. Really wanted to like drive for a bigger purpose, and so we moved to Lexington about 10 years ago, and I worked for DHHS and in-home family support. And that really is what started my drive to like do more. And then after family support, I worked for the court for almost 7 years. And I saw the link between criminal activity, mental health, and addiction, and how it just destroyed people's lives, literally. And so that really drove me to go back and get a master's degree at 38 years old. And so my role, I finished in December with my master's degree and mental health, provisionally licensed mental health practitioner, and a drug and alcohol, provisionally licensed drug and alcohol counselor as well. And so I really drove to get the extra certification as my work in the court. And so what I do is I'm subcontracted with the public schools as well. So I work with a lot of children that actually addiction beginning at 10 or 11 years old. And so God really like showed me like, oh my gosh, this is the reason you did this. And so I get a lot of the referrals for probation or even kids that are struggling at 11 years old. But I also work with adults of all ages. So my role is sort of unique, and that's what makes Lex Regional so, we have a great integrative healthcare system with everybody has sort of their specialty, especially the counselors. And so Tracy does EMDR, and Karina is bilingual and works EMDR and trauma therapy. And I work the drug and alcohol counseling side of it as well as the mental health side. So the link between what we see a lot in our world is the link between mental health and addiction is really co-occurring a lot of the time. And so it's just really an honor to serve the community and do what we do for our community. I guess I'm trying to think of what else I want to add as far as that goes.
You want to explain maybe what EMDR is?
Yeah. EMDR is eye movement resensitization therapy.
I always call it EMDR.
Desensitization therapy.
Yeah,
Sorry,
there you
I
go.
butchered that. But that takes a special certification as well. And it really works trauma from the past that people are struggling with anxiety or depression and they can't pinpoint it. So EMDR pulls people back many, many years with a certain process. And so Tracy and I believe Karina also does EMDR as well.
Karina actually does little kids EMDR.
Oh, okay,
because it's a
gotcha.
whole specialized thing, but it's very. I'll tell you, when I was a student, I watched this process, and it's kind of amazing. So anybody could actually go through it, and you don't even realize as you're doing it or as you're watching someone do it what it's going to bring up for them. But it's such an interesting process, and then it's that came up for me. And now I can process it, but you didn't even know it was there. It's a unique service, and I refer a lot of people for that because it's just, you don't even know. It's a crazy thing. So anyway, side note, I really love EMDR.
Yeah.
So.
But we wanted to bring that up is that is what, makes our mental health team special is we all offer something different that really can fit a lot of patients. And so I'll have kids that I'm trying the natural holistic approach. And sometimes it's just not enough. They need a little bit of a push to start to feel like themselves. So then the referrals go both ways. I'll refer them to Steph or Ann for some potential medication management while they're working through the mental health diagnosis and the heavy struggles right away.
Yeah.
Trying to think of what else I want to add.
I've heard a comment from my friends back here of just, we should have known this by now, so maybe just talk about that of just the stages of it.
Yeah, well, I'll be honest with you. There's a huge stigma around mental health, and it's been very, I would say probably, what do you think, the last 5 years, it's kind of emerged as more of it's okay to talk about this. If you need help, it's okay. I feel like in the past, just for me, for example, I'm 48, and I struggled with anxiety my whole life. And it was, you're okay, you can do this, just try harder, or you can push through this. And I love my parents dearly, but they thought that was helping me. It was not helping me. I needed somebody to talk to, but it's just kind of it wasn't a thing that we talked about when we were going through. So sometimes you get these hyper-focused kids because they're really trying hard to manage that anxiety. And I think adults do that too. As we get older, we just kind of okay, how can I manage? But really there's a lot of different ways to manage, and you don't realize it. So don't be afraid to talk about it. I think it's really coming more into the mainstream. And I know, for my practice, I love it that I see a lot of kids because parents are no, I don't know what to do. Please help me. Because we didn't see that probably 10 years ago. It was kind of that unspoken, I don't want to talk about it. You're going to be fine situation. I don't know. I don't know what you think, but.
No, I agree. I'm, in the short time that I've been doing this, and even backing up when I was working at the court, many parents don't understand, okay, well, my kid's committing all these criminal activity, what's going on? Well, the link between anxiety, depression, ADHD, and even addiction turns into that criminal behavior. And so I saw that at the court, and then bringing parents in now, I'm seeing more and more that just want to do whatever they can to help their kids. So I do feel like we're on the up and up as far as the stigma against mental health care, but we've got a lot of work to do yet. So.
So I do have a question. So you're talking about these kids in the court and older, and don't have any money.
Yep.
how do you take care of them and not get paid? What goes on there?
Sure. So most of the time when a juvenile is cited, they are issued probation. And so the beautiful thing about that, I mean, it sounds scary, but the beautiful thing about that is they're able to get resources. And so a lot of the times when they're ordered probation, the judge is also ordering counseling. And so then it gets paid for through probation if they don't have Medicaid coverage or appropriate health care coverage.
And what happens when a parent knows their person needs help? They don't have the money, they haven't been arrested. What happens then?
So we have a program at the hospital that, first of all, mental health wise, we don't turn anyone away. So if they come in and they're like, we need help, we see them. So basically the hospital takes that on and we deal with it kind of on the backside, if that makes sense. We have counselors, we have financial counselors, and we have a couple great community social workers. Maria, what's Maria's last name?
Reyes.
Maria Reyes and Isabel. Yes, Ruiz. There you go. Thank you. They like work in the community to identify needs. And so then like say, okay, your child needs help. I don't have money. I just lost my job at Tyson, whatever happens. You come in, you see us, we do all the things that we need to do. We don't discriminate, obviously. So we do this and then we get you set up with one of the like Isabel or Maria, and then they help you. And if you can't pay, it's fine. We figure it out. Like that's one thing that we have really committed to, especially family medicine clinic, is that mental health is more important than what the bill is going to say. So we take care of you. And I would say we do that with other things, but it's really very much mental health that we've kind of made it. And a lot of times those are the folks that need it the most. And so we've just kind of committed to that.
And then on that Medicaid side too, I know different in practice and in other towns maybe don't offer that for mental health. So I think that's amazing that we are able to.
Definitely.
Yeah.
Yeah.
That's probably why we pull from such a large area, but Holdridge does not have our services. There's a lot of places we just pull from such a large area because we're such a uniquely set up situation.
It's a great question.
Yeah. It is a good question.
Well, I am sure there's people who go, well, I can't do it. I don't have any money. I just,
Yeah.
what can we do to stay?
Well, and I know like hospital wide, there's been a huge push just since everything has happened in our community we really don't turn anybody away. So if you hear somebody or somebody has questions, just send them up and we'll figure it out. We've got all kinds of resources. So yeah, we don't want anybody not getting care. So it's
Right.
important.
Do you work with foster kids and foster parents?
I have multiple cases. Yes.
Their kids too.
Yes. Yep. I have multiple clients like that right now.
Well, and you have a really close relationship with the school system, which
Yeah.
is really important too, because that's kind of our conduit to know. And like Ann and I call the counselors all the time, but you guys are you and Karina are both in the schools and doing your things. So we
Yeah.
kind of get it from all areas. They probably can't escape us sometimes.
Yeah.
They're like, oh, geez, here are these people again. But,
Well, and even working at the court, I have multiple attorneys now referring people to me to do this substance use evaluation or potentially a co-occurring evaluation, whatever they need from that side. But also so I work the juvenile cases at the court, and so DHHS will refer kids to me now too.
Then maybe talk about the work that you with other counselors you in the school system.
Yeah. So when I was finishing my degree, I received an internship at Lex Public Schools, and so they assign based on referrals through the school system, and wow, they keep really busy over there. I think they had at least 100 kids they were servicing throughout the school year, and so I had I had the small amount, like 16 or 17 kids, depending on the week, that I saw, and it could range from, the child doesn't have the focus to do their homework, and so their grades are suffering, or depression, anxiety, extreme fear, could be abuse and neglect in the home. And so what the school offers here is really unique. I think there's only 5 districts in the state that offer what we offer here. And so really we're so blessed with that. But my kids in the school during the summer, some will integrate to the clinic. And then when school starts back up, we start back over on referrals. So
You said something like kids are getting addicted at 11. What is the substance?
well, it could start at nicotine. But a lot of the times, when what? Yep, sure. Yep.
I had an 8-year-old one time that had started with his grandma's oxycodone because she had chronic pain, but that's what everybody in the household was doing. And so he thought, well, I'm going to take one of these pills and see what happens. Well, then it just becomes, oh, I like that. I don't have to deal with my environment. I can sleep all day. 8 years old. But it's accessible. They see family members doing it. So it's kind of crazy.
Yeah.
It's very heartbreaking, actually.
Yeah, it's heartbreaking, but it's also very eye-opening, like as parents, grandparents, that these kids are exposed so young. And, we're so influential, we don't even realize it sometimes.
Absolutely.
With working at the Corps, my eyes were opened with multi-generational trauma, multi-generational addiction. And so I tend to have that perspective when seeing my students now. And many times they're very open about what they're struggling with. Sometimes it takes some time to get to the bottom of it. But very, very young. Yeah.
It's heartbreaking.
It is.
But the younger you can get them, the better your outcomes are too.
Right,
It's kind of a catch-22. If you catch them young enough, you can kind of turn that around.
Yeah.
I mean, that's what I've seen in my practice.
Definitely. I couldn't agree more. Like, if they come to you at 16 or 17 and tell you they've been smoking marijuana for 6 years, that's through their main brain development period. And so then trying to get them off of it is more difficult. Whereas if they're 11 or 12, we might be able to nip it right then and there and have it be a smoother process.
So, but then they go home, and the families.
So there's also a lot of community. I mean, I've talked a lot about all of our services, but we have wraparound services in the community. So there's regional things that the state has set up, what are we, Region 2 or Region 4 or
2.
something?
Yep.
So we identify those issues and then we do those referrals. And then you have people in the home. And literally we have people that go to the homes and help them parent. We have them set up a chore chart. Those people, we could do a whole, everybody come through here because there's so many things that go into these families. But every piece is important because you're right. If you don't have that home part, what's going to happen next? Mm-hmm. So there's all kinds of communities, and there's stuff for elderly, like Area on Aging and League of Human Dignity and those kind of things too. DHHS is a really good resource. If you need something for a family member, you just call and they'll be like, okay, well, let's do this or let's do that. So there are community resources too. Mm-hmm. And we have them here in Lexington, which is important because some communities do not have that access. So
Yeah, that's a great question too.
yeah.
Yeah, I have a great example of it actually. Situation where dad had a criminal charge for abuse. Region 2 goes in, sees the oldest child needs counseling. So then a referral is started through the schools, and then it ends up being somebody that I work with. So we have monthly meetings with Region 2, with the parents, and with the student to continue to work on, okay, well, what drove this anxiety and fear that you have? How's dad doing? How's mom doing? How's the child doing? Sort of a multi-systemic approach, which I love multi-systemic therapy as well. So yeah, it utilizes every piece of the student's life, whether it be the teacher, the parents, could be the nurse practitioner that's diagnosing or giving the medication. We integrate it all together. We have the opportunity to do that. So it really is, it's very beneficial.
John, say,
How do they sleep at night?
Yeah, sure.
Sometimes I don't very
Unfortunately,
well.
I'm tired a lot, so it works out okay. I mean, I just kind of feel like we all have our ways of coping, and we all kind of look at what we do. And I feel like my schooling definitely prepared me more than it did when I was family practice, because I would get into things and I'd be like, gosh, am I handling that well? Now I kind of feel like I know better, and at the end of the day, I feel like I'm doing the best help that I can. So I guess that would be how I sleep. I mean,
it's true.
There's some cases that don't leave you for sure. And you know that too.
Yeah,
But
yeah.
it's what it is.
Yeah.
Do the best we can.
Yeah, I think knowing that, okay, we gave it 100%, the result is not always up to us, giving them the most information we can. But there's definitely cases that carry you through, the night sometimes. Definitely. Yeah, it can be challenging. But a good support system at home is sure helpful. So
Oh, yeah. Which both of our husbands are in law enforcement.
mine just ducked behind
I was
the
going to say, so
counter.
we've been doing this for a long time.
So yeah,
Yeah.
that's my husband back there.
did you see a surge in kids' depression after this plant closure?
A little bit.
parents.
Yeah, especially in
I would
the
say more
schools.
adult. Like
Yeah, that too.
I feel like I've had more adults, like just that uncertainty. And there was a certain age of worker that definitely got phased out and they didn't have a lot of opportunity. Like that's more what I saw. But you deal more. I mean, I haven't. The kids are okay because the parents are making it okay. I feel like in our community too. So it was more parents for me. But
For me, since I'm in the schools, I had multiple kids come to me with worry and fear, like, well, how are we going to keep the lights on next month? Or I'm worried that mom and dad aren't going to be able to pay rent. And so we would bring mom and dad in during that, and I would advise the fear and the worry. And so, yeah, Steve, definitely, I saw that a lot. A lot of kids scared. Are we moving? Where's mom and dad going to work? Oh, dad's at, JBS in Grand Island, but mom still can't find a job. How are we going to make bills? What are we going to do? So definitely.
Which isn't something kids that age.
Right. And that's where the sadness for me comes. That's where I carry that. Like, oh, I'm so sad they're worrying about their parents' bills. Yeah.
that's terrible what happened in our community in general.
Yeah.
Like, it's just,
Yeah.
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 So this crew, I think, already has some great mental health regimens that they work out.
Oh, yeah.
Here, are there any other tips that you have for this generation, or what can we do going into the summer? I know Ian talked in December on getting outside or getting the sunlight, but going into summer, what are we?
Good sleep habits are really important. And they're harder as we get older. We don't want to, our bodies just tell us not to sleep as much. So making sure you get an annual wellness visit, get your labs checked, make sure you're healthy that way. That's the family practice side of things. Make sure your blood pressure's okay, your medicine's where it needs to be. But definitely the sleep pattern and the exercise is great. You guys already got that handled. And just doing things you enjoy. I feel like you have to have something that you find joy in every day, whatever it is.
Yeah. I guess for my perspective, the counseling perspective is, if you feel like something's off, it probably is. And so what we do is, the holistic approach of like, I'm going to take the hammer and nails and we're going to figuratively build you a toolbox and pull tools out of it when that anxiety or depression or worry or fear, whatever is facing your life at this time, I guess just don't be afraid to seek the help that you feel like you might need. There's no stigma in our offices, so
It's all confidential.
yeah, it's all
Nobody-
confidential.
Nobody knows.
We can help you work through about anything, and if we can't, we have the referral base to do that. So
We know people.
This age group, I now one family member and another person I know quite well are dealing with the dementia and having to have the person leave home, and the guilt and the whatever, and they're actually have more problems than the one that's in the home because neglected their health.
Yes.
And you offer service like help them through that.
definitely.
Yep, absolutely. Counseling would be appropriate. Maybe some medication management. Maybe they need just a wellness visit to figure out their own health too. We do all of that.
Yeah, and just from the counseling side as well, like if someone says they feel guilty about it, my job would be to approach it at another angle and help them see multiple perspectives, focusing on what they have control over and what they don't. And, form a treatment plan based on their goal with that guilt and work through it together. Yeah, it's a great question.
Dementia's tough.
Yeah.
It's very tough to work through. But we can help you with that for sure.
Yeah, but it's it's
Any
I
other
keep looking at
questions?
Brenna because I'm like, what are you going to ask us next?
and there's something we taking stuff at the teacher.
Let's do it. Well, I'm wondering, you're all female. Is that a drawback?
Well, honestly, we've had some male students and we've tried to get hey, come work with us. And it just hasn't worked out. But I don't know, we're a really close team. So I think for us, it's really good. Sometimes it makes it hard for the teenage boys. I have some referrals sometimes and I'm like, man, I got to refer this kiddo out to a counselor that's a male. It's very, you'd be surprised though. It's a very small group. A lot of, teenage boys are fine talking. I think we're all kind of motherly enough that they're like, okay, fine. But there are a couple that you're like, this isn't going to work. You got to have a male. So, but honestly, mostly it's fine. I don't know.
Yeah.
You're the newest one in. So I feel like we kind of all, but like we were so excited to have the substance abuse part that we were like, oh my God, yes, we have this now. So, because that's a huge chunk of mental health. So,
Yeah, definitely.
yeah.
No, I agree with that as well. Like the majority, I mean, as far as I don't know about counting, but I have a lot of male
Yeah, that's
boys, students, and adults too.
Yeah.
So, but agreed. Like there is times where they only want to talk to a male, and so that's where the referrals would come in, like outsourcing outside of Lex Regional Health Center.
Yes, yeah.
But we've got people everywhere.
Yeah.
You got to find them, right?
Yep.
You know, we got your body.
8:30.
That's pretty good. It is very informational. Thank
Yeah.
you.
Yeah, absolutely. Yeah, absolutely.
Thank you for having
Thanks
us.
for having us. Yeah, this was fun.
Appreciate it.
Wait, don't do it. Should we bow? No, I'm just Take a bow. Off we go.